We have here another specimen of for the upper extremity. We're still in the shoulder and arm area. We will focus mainly here on the anterior and medial aspect of the arm and the shoulder. Let's start with the large structures once again. This one is the clavicle with the subclavius muscle right there. That's the subscapularis, no? Subscapularis muscle. We have the deltoid, section of the pectoralis minor, section of the pectoralis major. We have the biceps brachii muscle right there. So let's go to the nerves and vessels, no? Which I would say would be the highlight for this video. So we have the axillary artery right there, plus the axillary vein. You can also see the three cords of the brachial plexus. We have the lateral cord, the medial cord, and the posterior cord right there. So let's identify once again terminal branches. We have the median nerve coming from both lateral and medial cord, and then we have musculocutaneous nerve. Let's try to trace where does the median nerve go. It will actually innervate structures in the anterior compartment of the forearm. Median nerve does not innervate anything here in the arm. Then we have the ulnar nerve right here, coming from the lateral cord. This one, that's the ulnar nerve. The smaller nerve is cutaneous nerve to the arm. So if we trace, we follow the course of the ulnar nerve. You can see it's right there. It goes towards the posterior. It goes towards the medial aspect of the arm, going to the posterior compartment of the forearm. Let's adjust our specimen right here. So let's identify some structures in the elbow area also. This is the olecranon process of the ulna. The bony prominence right here, that's the medial epicondyle of the humerus. You can see the ulnar nerve, no? It will follow a very superficial course right here in the elbow region. It will cross behind the medial epicondyle of the humerus. Sometimes we hit this area, this part of our elbow against a hard surface, and we feel a tingling sensation, shooting. We feel something like an electrical shock, which shoots up our arm. That is due to irritation of the ulnar nerve, as it is stimulated by the trauma when you hit this particular area of your elbow. Triceps muscle. You can see the long head and the lateral head. The deltoid muscle. That's the area of the quadrangular space or quadrangular interval. No? You can see the axillary nerve, no? Plus the posterior circumflexhumeral artery arising from that area. Teres major, we have the teres minor, infraspinatus muscle, no? And this will be the rhomboids, no? While this one down here should be the this one is latissimus dorsi, and this is proximal part of serratus anterior. Let's go back to the medial aspect, where we have more vessels to identify. No? So this vein right here is the basilic vein. The basilic vein, we can trace it down. No? It courses along the medial aspect. No? We can trace it down, coming from the medial aspect of the forearm and from the medial side of the dorsal venous arch of the hand. You can see the origin of the tributaries, no, to the basilic vein right there. And then on the other side, we have the cephalic vein. You can see it coursing, no, along the deltopectoral groove. No? You can see the cephalic vein, no? Coming from the lateral aspect of the dorsal venous arch of the hand right there. So at the area of anterior aspect, no, area of the elbow joint, we call that the antecubital fossa. You can see anastomosis, no? Anastomosing vein, no? Connecting your basilic with cephalic. That's the median cubital vein, another clinically important vessel. We extract, no, blood, usually using that particular vein. And up here we can see the brachial artery. And this muscle right here, that's the coraco brachialis muscle, and not very visible, no, but it's right there, no. That's the brachialis muscle. And then we can also see right here the deep head of our triceps brachii. So in the other plastinated specimen, the veins were actually stripped. They were missing from the other specimen. And aside from that, no, the brachial artery, no, in our other specimen was pulled away from the arm, so that it can be traced, no, better. But